So the next procedure that I'm going to perform is the bed bath. Bed bath refers to the methods of cleaning or bathing the patient who is confined in bed using basin with warm water and washcloth. This is to maintain the hygiene of the patient and to give comfort when they are unable to bath independently. So the equipment needed for this procedure is basin with warm water, comb, clean gown, washcloth, towel, bath blanket, and lotion, which is optional. So in assessing the client for bed bath, first is we need to assess the client tolerance for activity. So mag-ask of questions about sa kanang kung nabay nabatian at akong patient nga pain karon o kanang ma-move ba niya iyang kalawasan or i-observe na ko ang iyang ability to move. So good day ma'am, naba kay nangabatian sakit karon sa imong kalawasan ma'am?
Wala.
Pwede nimo ma-move imong kamot ma'am? Hinay lang. Because ma'am, napakay nabating yung sakit pag-move ni mo, ma'am.
Wala.
So this is to determine the appropriate pace for the bath and to ensure that the client is comfortable and in control throughout the process. So next is assess room temperature and ventilation. So this is to ensure that the environment is safe and comfortable for the client during the bath. So next is wash hands. This is to prevent the transmissions of microorganisms and then gather all necessary equipment for AC accessibility and to promote smooth bed bathing and then identify the client and explain the procedure. So, good day ma'am, I'm Jasmine Erio, your student nurse for today. So, we're going to do bed bath ma'am. Mag-trapo ta sa imong kalawasan ma'am since dili ka makabat sa imong kagalingon. So, I hope nga mag-cooperate ka during this procedure, ma'am. May I know your name, ma'am?
I am Ronabel AOC.
Okay, thank you. So, this part is to ensure or to verify the patient's identity and to ensure that the patient knows what we're going to do today and how she can cooperate. So, next is provide patients privacy or provide clients privacy. So we can provide clients privacy by closing the windows, doors, or curtains. This is to ensure patient's privacy and para po comfortable po datong patient during the procedure. So next is offer bedpan or urinal. This is to ensure that the patient is comfortable and to avoid any interruptions during the process. So, and then adjust bed to a comfortable working position so that kanang dili lang ang patient ang comfortable sa during the procedure pati pud taang nga nag-assist sa patient para pud dali ang atong pag-assist sa atong patient. So as if ma'am nga ako nang gi-adjust ang bed and then please bath blanket over the client before removing the top sheet. So this is to maintain the privacy of the patient. So next is remove client gown, ensuring he or she is covered with blanket to maintain the privacy of the patient, ma'am, o comfortable po siya. So akong i-remove ang kuan. And then pull side rails up and fill basin with warm water. So para dili makuratan natong patient if bugnaw ang tubig. So kailangan yun warm water. Next is place client in a semi-fowler position and remove pillow if permissible. So akong tanawon ang data sa akong patient if okay ra ba nga tang paon ang iyang pillow or dili kay basin masamutan iyang condition. So as if ma'am magitan So as if ma'am nga gitanaw na nako iyang detaw. So and then make a meat of the washcloth. Mo na siya atong gamiton sa pagtrapo sa lawas sa atong patient. So next is wash client eyes from inner canthus towards the outer canthus. So hinay-nayon nato para dili makuan kuratan atong patient. Ma'am, i-close imong eyes, ma'am. So i-ensure nato nga nahinduan natong tarong ang mata sa atong patient which is wala na nabilin nga muta sa iyang mata. So next is wash client face, ear and neck. Rinse, spot and dry. Next is wash arm away from you, distal to proximal, including the axilla, using long firm stroke, rinse and dry. And then repeat the procedure on the arm near you. Next is wash client hands in basin, rinse and dry. And then wash client chest and abdomen using long firm stroke, rinse and dry. So next is expose one leg at a time and wash leg far from you with long firm stroke, rinse, spot and dry. And then repeat procedure on the other leg near you. So next is immerse and wash client feet in the basin, rinse, spot and dry. So next is replace water. So this is to maintain clean water in wiping the back and the buttocks of the patient. So turn client on her side and place towel alongside of the back and wash back and buttocks using long firm stroke, rinse, spot and dry. So next is place client in a supine position and cover with butt blanket and then wash the perineal area, rinse, pat, and dry. If client is able, place towel under the buttocks and bring basin and soap within the client's reach. Instruct the client to complete the bath, him or herself. So, ma'am, so, ma'am, kaya ra ba nimo nga ikaw ang magtrapo sa imong perineal area, ma'am? Imong kilis imong kuan?
Yes.
So, nara ang gamit, ma'am. Para pang namin, ma'am. So, next is have client wear new gown and comb hair and apply lotion if desired by the client. So, ma'am, gusto ba nimo mag-lotion, ma'am? So, next is remove equipment and store them in a proper place. Para ma-maintain na itong aseptic conditions sa itong equipment o para dili sila mga guba. So, next is wash hands. This is to prevent the transmissions of microorganisms. So, next is evaluate the client's comfort. So, ma'am, napaka ini-complain ma'am sa itong pag-bed bath, ma'am?
Wala.
Wala ba kayo lain gipangkuan din na ma'am kanang unconfirmed ma'am?
Wala.
Okay, thank you. So the last thing is document all procedure to include the type of bath administered and the client's complaint. Para po ni siya sa legal document o ma-record po nato ang kung sa itong ipangbuhat sa itong patient karon. So that's all.